This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And good morning, Dave Wilson with you. Sarah Giosi will join us shortly. Coming up on today's show, we're going to talk heart health. It is one of the biggest health issues across the state of West Virginia. We'll talk about prevention, what families can do, and how you can be more heart healthy. Joining us in studio this morning is Dr. Brad Warden, cardiologist, executive director, and chief of cardiology at the Mon Health Heart and Vascular Center. Good morning, Dr. Warden.
Good morning.
How are you doing over there?
Thanks for inviting us. I'm doing great.
Get right up. I pull that mic to you. Get right up on it there. So, all right, there we go. That's perfect. Before we jump into prevention, and a lot of this we probably know and ignore, to be honest about it. Let's get a little bit about your background, how you ended up at Mon Health.
I am originally from Morgantown. My father was the first heart surgeon in the state of West Virginia. Moved here in 1959, so I've lived here most of my life, except for when I went away to school. I'm back here. I had my medical education at WVU, and now I'm over at Mon Health.
Sneaking into the frame there, Sarah Giosi.
Oh, see, it's radio. I forget we video these.
Yeah, the video's rolling.
Know.
We caught you. We caught you.
I'm here. Good morning.
Good morning, Sarah. We're talking with Dr. Brad Warden. So you're a cardiologist, but do you specialize? Is there a specialization within that field?
Yes, I'm an interventional cardiologist, so I do things like put stents in people and so forth, but also medical therapy and take care of patients both in and out of the hospital and clinic as well as in the hospital.
Are you going to be the guy, if I got to go in, get something repaired, are you going to do it for me?
I'm the guy.
You're the guy.
There's a whole group of us. Don't get me wrong. There are 5 interventional cardiologists at Mon Health, so we've got a great team that we put together. Well,
as I mentioned right off the top, Sarah, heart disease and West Virginia, it's one of the biggest problems throughout the state of West Virginia, and a little bit out of left field here, Dr. Warden, but can you put that into perspective, the problem we have in West Virginia with heart health as a whole?
Yeah. When you look at risk factors for coronary disease, West Virginia ranks really high in all those, unfortunately. We love ranking high in sports, but not so much in these risk factors. We're the #1 state in obesity. We're the #1 state in smoking. We're in #3 in diabetes in the country and #2 in coronary disease. So it's it's a big problem. There's a large part of the population has has coronary disease and so forth, and we see it every day.
What kind of trends are you seeing here in North Central West Virginia in particular?
Well, we see it's not so much a trend, but we just constantly see the results of all of these risk factors, and we try on a daily basis to communicate with patients, families, and so forth about these risk factors, because that's the most important thing. I mean, yes, during the acute event, catheterization and putting stents in people and so forth are great, but we really need people to take a serious look at their lifestyles. I mean, taking a tablet in the morning is relatively easy, but behavior modification is much more difficult than just taking medicine.
Well, and I do think we've come a long way whenever we start to talk about trying to cut out some of these habits, things like smoking. We've come a long way. But, and one of the jokes that you hear now, a little tongue-in-cheek, is talking about how now sitting in front of a computer all day is the new smoking. And we do have these new habits that are starting to form, just culturally speaking, that are also playing a major role in all of this, right?
That's right. I mean, when you look at history and perhaps why coronary disease is so much more prevalent now than it was before, remember that 50, 70 years ago, our grandfathers and so forth, they worked, but a lot of them did manual labor all day. And although their dietary habits may have been somewhat similar, although not as many processed foods and so forth, but their caloric intake may have been the same. They burned off a lot of those calories in what they did every day. Now you see people, with automation and so forth, you see people have very sedentary lifestyles, and yet our dietary habits are the same. And the other thing, honestly, is that this whole trend from back in the 70s, and you can read all the different takes on this, but there's like a conspiracy theory about sugar, how they identified fat as the real culprit for coronary disease. And everybody tried to go low fat. The problem with low fat is that you have to make it food appealing to people. So it either has to be salty or it has to be sweet. And when it's sweet, your carbohydrate intake for the population went way up, and that's why you see this huge increase in the percent of the population that's diabetic, is because you're exposed to a lot more carbohydrate. And the truth really is, it's probably just like your grandmother told you, a well-balanced diet is probably what's best for you. Getting your vegetables and so forth, cutting out a lot of sweets and processed foods, and just a more natural approach to that.
I tell Dave every day. Do I not? I do. I get on him all the time.
I was just going to say, we like to throw out all the time, Granny cooked everything in bacon grease, and we always leave out the part where Granny and Granddad worked out in the garden all day, and Granddad was a carpenter who worked out in the sun all day. We leave those parts out. We just like to throw in that Granny cooked everything in bacon grease.
And again, that food wasn't processed the way it is now, which is important. You mentioned that. I mean, it's really important how the food is made, where it's coming from. It's not from the garden. It just changes. So
yeah. And they also, but also as part of that, Granny might have cooked some things in lard, but that she cooked vegetables, and she cooked meat, and she cooked, maybe a starch with the meal. But again, you burn those things off. So it is a well-rounded diet that's really better for you. And they did harvest. They harvested in the summer and the fall, and in the winter and spring, the people canned.
Yeah.
So they had access to vegetables, 12 months out of the year. That they planned for it.
Tell you what, there's nothing better than a pot of half runners with a ham bone in it. See, he knows what I'm talking about.
There you go. That's right.
We're talking about heart disease on Mon Health Talk today. We've already started down the road. We're going to continue prevention, and that is a theme in every single show that we do. Is it's much easier to prevent than treat after the fact. So we'll talk about preventing heart disease on the other side of this break. You're listening to Mon Health Talk on WAJR. Mon Health Talk continues. Dr. Brad Warden is our guest, cardiologist at the Mon Health Heart and Vascular Center. Of course, Sarah Giosi to my immediate right. We're talking, of course, heart disease. We've talked about some of the risk factors. By the way, can you be, is it a genetic thing? Can you be genetically more at risk if you've got a family history of heart disease than, say your spouse?
You can be genetically more prone to coronary disease, but it's sort of a chicken and egg question too. Sometimes people in families, they tend to have the same dietary habits. Some of them, if your father or mother is a smoker, you're more likely to be a smoker. So is it that your genetics actually predispose you to this? And I think and the answer is yes, that can be part of it. But also, can it be that diabetes, hypertension, smoking, sedentary lifestyle, those things tend to occur in families. It's learned behavior, and those things all contribute to coronary disease. So
we talk about that all the time with so many issues, how cyclical they are. And it's passed down from generation to generation behaviorally, because that's what you're learning, that's what you're brought up seeing. And this, clearly is no exception to that. Maybe
a better phrase would be family history.
Yeah.
to
right,
document
exactly.
That.
Yeah, that's right.
We kind of started on it there in the last segment, talking about diet. Granny used to cook everything in bacon grease, but at the same time, Granny and Granddad were active as well. They, Papa wasn't sitting at a computer 8 hours a day like I am. So when we're talking about prevention, it's probably the age-old adage, diet and exercise, right?
Diet and exercise, very important, absolutely necessary. You really do. In people that don't have coronary disease, the prevention is important. In people that do have coronary disease, just reducing their risk of a recurrent event is important, and diet and exercise is all part of that. From a physician standpoint, there's really basically three things that we can do. We can control diabetes if you're diabetic, control your blood pressure, and control your cholesterol with medicines. But that's really it, and the rest of it is behavioral modification. Like I said, diet, exercise, stopping smoking, those kind of things. And like I said, that is a much more difficult part of the puzzle. People often ask me, what specifically was it that made me have this heart attack or made me have these blockages in my arteries? And the truth is that you're a puzzle. All these pieces go together to make you. So, and all these things contribute in different forms and fashions. Yes, there are people who can smoke their whole life and live to a ripe old age of 90. That's true. There are also people that I've sent a patient for bypass surgery at 27 who's a smoker. So smoking affects different people in different ways, but you can't kid yourself and think that it's good for you. That's a basic element that we need to all agree on, that it's not good for you.
If we have people in our family or close friends, relatives that are maybe going down a path that's unhealthy, how can we help to support them? How can we encourage them to try to change some of those lifestyles?
Well, I think a lot of it is by example. I mean, I think if you want your family members to be more active, you have to be more active. You have to show them this is the right road to go down. If you think that your dietary habits are not good, you need to change what is being prepared or what's available in the home for people to have access to, and so forth. And then also the other part of it is the family medicine doctor, the internal medicine doctor, the person who's your primary care doctor is very important, and they will address these risk factors and identify these things before you have coronary disease too. And treated, it reduces your risk of developing that.
One of the things that I hear a lot, and I do want to say, you do make it as affordable as possible for people to come and get care, absolutely. But one of the things we do hear a lot is, well, it's so much more expensive to eat right. Oh, it's so much more expensive to have a gym membership. It's so much more expensive. But at the end of the day, what an investment in overall health. And whenever you look at that versus life insurance rates or insurance policy rates, if you are a smoker or it is cheaper, right?
Well, in the big picture, yes. To society, it's cheaper. but I will tell you this. I do understand when people say those things, because if you, we were talking during the break about there's certain socioeconomic things that contribute to this too. I mean, the marketing for cigarettes is targeted at people of lower socioeconomic situations. And if you have kids and you don't have a whole lot of money and you want them to be full for the morning, think about it when you go to a cafeteria or you go into it's cheaper to get biscuits and gravy than it is to get a fresh fruit parfait, Mm-hmm. So those things really are true, and there are a lot of families that are struggling to keep their families fed and to keep them full and not hungry, and we need to be respectful of the problems with that. And I did read about some changes that are going on. They're trying to bring some farmers markets into regions of the country where they don't have availability. So say inner city people don't have many fresh farmers market and buy directly from the farmers, and they're trying to subsidize some of those things to get farmers into those areas so that people can buy those vegetables at a reasonable mm-hmm. price and can introduce them into their family's diet.
That's even happening on the opposite scale in very rural places where people they have to go miles and miles and miles to get to a grocery store, where it's allowing food to come into local communities that's fresh produce that otherwise they can't get because they can't get to a store to get it.
That's
it's
right.
Amazing.
That's right.
Take it. We're so lucky here. We just take it all for granted.
Got to squeeze in our final break because I want to make sure we mention some of the innovative treatments going on at Mon Health. We'll have a couple of minutes left with Dr. Brad Warden, cardiologist at Mon Health Heart and Vascular Center, when we come back after this. Talking to Dr. Brad Warden, cardiologist at Mon Health Heart and Vascular Center. Got a tweet into the show just a moment ago. Just wanted a clarification. When you're talking about diabetes as a risk factor, are you talking type 1 or type 2?
Actually, both of the diabetes are risk factors for coronary artery disease. And one of the main things that a diabetic should be looking for is you should know your number, okay? And this number is a measurement. It's called a hemoglobin A1c. It is a number that tells you, on average, where is your blood sugar running over the last several months. And it tells you whether your diabetes is under control or not. And your doctor should be sharing that information with you. You should be talking about it and trying to work on getting that number down to a more reasonable level. Less than 7 is the usual recommendation.
Some innovative treatments going on at Mon Health. We got about 90 seconds. What's the Watchman device? The Watchman device is a device that goes into the heart, and there's a little cavity in the left chamber of the upper chamber of the heart where most blood clots form when somebody has atrial fibrillation. You put this device into that chamber and you let it heal and just become part of the wall, and then you can take patients off of anticoagulation. They don't need to be on that for a lifetime when they have the atrial fibrillation. What's TAVR? TAVR is replacing the aortic valve through the arteries in the leg. Before, you had to open the chest to replace the aortic valve. Now it's possible in certain situations when you're intermediate or high risk to have that surgery done to replace the valve by passing the valve from the leg up into where your aortic valve sits now. Use a balloon to deploy that valve, and it starts working immediately. And you don't have to have the open surgical procedure. Patients are discharged home the next day. The next day? The next
That's
day
amazing.
following that procedure.
That's just amazing.
Yeah. And is it cardio MIMS?
Yeah, there's a device with people that have congestive heart failure. We usually use a tube in the hospital that goes into the lungs to measure the pressure in the lungs. There's a little wafer that we put into the lungs. The patient lays down at home, and a pad that they lay on communicates with the device and sends the information to us and tells us what the pressure is in their lungs. It turns out that weeks beforehand, before you have an episode of congestive heart failure, the pressures start to rise, and we can intervene and change your medicines and try to keep you at home.
Fascinating discussion, but we are all out of time. Thank you very much, Dr. Brad Warden, cardiologist.
Thank you so much.
Coming up, we've got the news at the top of the hour. Next week on Mon Health Talk, we're going to talk diabetes, how to manage them through the holidays.